The radical changes brought about by COVID-19 had put nurses in a vulnerable environment. Will the ongoing pandemic have an impact on the caring efficacy and job satisfaction? A pleasant day to everyone. I am Martina Therese Ferrer, and together with me are Joepat Cuenca Jr., Khezia Paula Dumala-os, Darriene Gayle Dusaran, and Rosheil Fuentes. Today, we'll be presenting our research entitled Caring Efficacy and Job Satisfaction of Staff Nurses in Selected Private Hospitals. Numerous studies have already explored these two variables globally. However, only a few were conducted during the pandemic and none was conducted in the local, especially the relationship between these two. Hence, this study aims to determine the caring efficacy and job satisfaction of staff nurses in selected private hospitals. Specifically, this study aims to provide answers to the following questions. What is the socio-demographic profile of staff nurses? What is the level of caring efficacy and job satisfaction of staff nurses when taken as a whole and when grouped to subscales? Is there a significant difference between the overall level of caring efficacy, overall job satisfaction, and profile variables? Is there a significant relationship between the overall level of caring efficacy and overall job satisfaction of staff nurses in selected private hospitals? Let's proceed to our research design. This study employed a quantitative research design, specifically correlational research design, using a survey method with three-part questionnaire. For our study sample, a sample of 92 staff nurses from various wards and departments of the selected private hospitals was obtained using convenience sampling technique, taking into account the busy schedules of the staff nurses. For our research instruments, a standardized questionnaire adapted from Paula A. Spector for job satisfaction and Carolee Coates for caring efficacy were used. The questionnaire was divided into three parts: the socio-demographic, job satisfaction scale, and caring efficacy scale, respectively. Likert scale was also utilized to obtain their preferences under a set of statements.
Out of the 92 participants, the majority of the staff nurses are young adults, female, and single, holding a bachelor's degree with 1 month to 1 year length of experience, mostly assigned in a medical ward. The findings revealed that staff nurses have moderately high overall caring efficacy. In terms of its subscales, the data showed that staff nurses' level of doubts and concerns are slightly higher than their confidence to care, although both fall within a moderately high level of caring efficacy. Staff nurses have moderate job satisfaction when taken as a whole, particularly when grouped according to subscales. Nature of work obtained the highest among moderate satisfactions, while contingent benefits gained the lowest among moderate dissatisfaction.
Furthermore, among the profile variables, the difference was only significant in overall carrying efficacy scale when grouped according to age, showing that younger adults obtained a higher overall carrying efficacy scale than old adults. However, there is no significant difference between overall job satisfaction when grouped according to profile variable, implying that profile variables are not contributing factors of staff nurses' job satisfaction. Lastly, the result illustrated that there was a significant relationship between the overall level of caring efficacy and the overall level of job satisfaction of staff nurses with moderate positive linear correlation. Thus, staff nurses who perceive themselves to be confident and effective at caring for their patients are more likely to report higher levels of job satisfaction.
Even with the significant presence of staff nurses' doubts and concerns, they were still able to express a caring orientation with their patients despite the pandemic's constraints, implying that the nursing tradition still values the process and quality of a nurse-patient caring experience. Hence, this value is also depicted as nurses are generally satisfied with their job with the nature of work being the highest factor, indicating that they find their work fulfilling. The moderate levels of caring efficacy and job satisfaction suggest that further improvements must be addressed as the pandemic still had implications for various aspects of the medical sector, both directly and indirectly. Profile variables except for age in the caring efficacy were not a contributing factor of staff nurses' caring efficacy and job satisfaction in selected private hospitals. Finally, staff nurses who are confident in expressing a caring orientation to their patients are more likely to be satisfied with their jobs and vice versa. Hence, efforts geared towards caring efficacy can contribute to the external factors of job satisfaction, which may empower them in their role and potentially improve both patient and nurses' caring experience.
The conclusion of this study leads to the conceptualization of recommendations that may be referred to the stakeholders for review and utility. Hospital administrators may strengthen and ensure that adequate access to resources and services are provided, such as facilitating trainings related to current health trends, counselings to evaluate their mental health, improving fringe and contingent benefits in accordance with established laws, and solicit staff feedback by conducting surveys once every 3 to 4 months in order to take staff nurses' suggestions and concerns into consideration. Nurses may participate in professional development programs such as continuing education courses, seminars, and trainings in order to keep up with the latest developments, including new protocols, safety measures, effective communication skills, and caring abilities that would allow them to be confident in providing care amidst pandemic, leading to job satisfaction since majority of the nurses are new. Nursing educators may supervise and encourage students to practice therapeutic care and effective communication during return demonstration and simulations in order to bridge the gap between knowledge and practice in preparation for their clinical exposure and in the future with an actual patient. Nursing students may practice caring orientation and effective communication skills to establish confidence to care and satisfaction in the field of nursing and the profession itself in the future. Self-awareness must be practiced as well to identify areas of strengths and weaknesses for improvement. A larger sample size to improve precision, confidence, and reliability of the research findings is recommended. Moreover, future researchers may explore public hospitals to find out whether this variable may be a contributing factor to the level of caring efficacy and job satisfaction of nurses. For the references, please scan the QR code provided below. Thank you for listening, and God bless.